My name is Faina Shtern. I'm a president and CEO of Admitech Foundation, organizer of the 7th Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. Admitech Foundation is a nonprofit organization leading international programs in prostate cancer education and research, public awareness, and advocacy. Our programs have been transforming patient care and reducing health disparities in Black and Hispanic men. Grant Rounds in Urology serves as our summit media partner. On behalf of the Admitech Foundation and Grant Rounds in Urology, I'd like to welcome everyone to our event. The annual summit was established in 2016 when PSA screening has already become more successful in reducing mortality than many other established cancer screening programs. Unfortunately, since about 2009, PSA screening ended up in the midst of the most intense public debate and controversy, a situation quite similar to what happened several decades earlier with film-based mammography and breast cancer screening. I had the privilege of leading diagnostic imaging at the National Cancer Institute and NIH at that time, and we brought together international, multidisciplinary key opinion leaders from academia and industry to design NIH programs that strategically focused on accelerating development of digital mammography and advancement of diagnostic tools, including MRI, ultrasound, and image-guided stereotactic biopsy. These advances in screening and diagnosis have transformed breast cancer care and shifted controversy surrounding film-based mammography into the dustbin of history. We established annual global summit on precision diagnosis and treatment to follow this breast cancer model for prostate cancer. Indeed, we brought together international, multidisciplinary key opinion leaders to address fundamental challenges in prostate cancer care, including expedited development of accurate diagnostic tools that would enhance the value of PSA screening even further, by reducing overdiagnosis and overtreatment of subclinical indolent prostate cancer, and underdiagnosis and undertreatment of aggressive disease. Our mission is to integrate multiple diagnostics, anatomic, biologic, histologic, into a comprehensive multimodality patient evaluation needed for such a complex biologic disease as prostate cancer. Our summit convened multiple experts to transform silos surrounding various individual diagnostic tools into the integration of liquid markers, imaging modalities, cancer tissue genetic profiling, proteomics, pathology, and immunohistochemistry. Over the last several years, our mission is becoming a reality. Our speakers will highlight the importance of diagnostic integration for every cycle of patient care, screening, as well as patient evaluation before and after biopsy, before and after treatment for localized, recurrent, and advanced disease. Since 2016, we championed radiogenomics, integrating imaging and tissue genetics. More recently, a more accurate term emerged, multiomics. The summit will have the first panel on multiomics. This year, we again have a panel that will show the role of bioinformatics, artificial intelligence, machine and deep learning in a multifactorial, complex data generation, analysis, and predictive modeling. This is in alignment with another aspect of our mission, to integrate precision diagnosis and precision treatment for selection of optimal patient management strategies. This year, our goal is to show how imaging, molecular markers, proteomics, germline and somatic genetic mutations, circulating tumor cells, DNA and RNA can enable precision individualized treatment in experimental and clinical settings. For example, we will highlight clinical, proteomic, and genomic implications of the invisibility and visibility of prostate cancer on imaging. You will also see the expanding discovery, research, and clinical implementation of prostate cancer targets for diagnostics, drug development, and clinical therapeutics. We will discuss how precision care can reduce health disparities. To achieve these goals, our program will have the following components. Session number 1 will focus on patient population prior to diagnosis of prostate cancer, including improvements in risk assessment, patient selection for biopsy, and tissue sampling. Session 2 will focus on men with localized and recurrent disease, including clinical evaluation and selection of appropriate treatment. Session 3 will examine precision oncology for advanced prostate cancer, including accurate diagnosis of regional, oligometastatic, and systemic disease, and its impact on a new standard of care and emerging treatment strategies. Session 4 will review critical challenges in minimally invasive image-guided treatment, including target definition, patient selection, monitoring, and outcomes. As mentioned, we'll have 2 panels, bioinformatics and machine intelligence, and health disparities. I'd like to express my gratitude to our governing board, AdmitTech team led by Thomas Satam and Emma Coyard, event management consultants headed by Nancy Petkunas and Josh Garneau, Grant Rounds in Urology, our media partner, led by Mark Weatherby and Greg Donahue, an international organizing committee, which was formed to increase participation of the previously underrepresented regions, including Middle East, Africa, Asia, India in particular, and Central and South America. In particular, I'd like to thank our board members and Dr. Raja Kohli, professor of urology at American University of Beirut in Lebanon, and professor of surgery and urology at University of Illinois in Urbana-Champaign, for his tireless efforts in chairing and assembling our outstanding international organizing committee, including Dr. Saad Al-Dusari of Kuwait, Nibras Al-Hamdani and Asama Al-Naziri of Iraq, Khalid Al-Rumeihi of Qatar, Daria Balbey of Turkey, Carlos Buchpigel of Brazil, Juan Galvez and Ray Manea-Kop of Colombia, Michelle Jabour of Lebanon, Nathan Lorenchuk and Philip Stricker of Australia, David Margel of Israel, Raluca Mititelu, Romania, Ahmed Morsi of Egypt, Vedank Murthy of India, Deni Rabah of Saudi Arabia, Rabi Redwayne of Morocco, Mike Satege of South Africa, Mohamed Shahed of United Arab Emirates and Jordan. This virtual summit was made possible by the state of Massachusetts with support of the leaders of legislature and our sponsors, including silver sponsors, Exact Imaging, Johnson Oncology and J&J, Lantheus, and Point Biopharma, Blue Earth Diagnostics, MDX Health, Pfizer, Philips, and Siemens, bronze sponsors, exhibitors, Avenda Health, and PHRMA. I hope you will join us next year for our 8th annual Global Summit, scheduled tentatively for September 26th through 28th in 2024. Thank you for your attention.